Okay. All right. Good morning, everyone. Happy New Year. Excited for this conversation that we're going to be having today with Dr. Hillary Lin. Um, she probably needs no introduction. If you're watching us on LinkedIn, you probably have seen or heard from her. She is one of my favorite voices in this new and emerging longevity space. She is a practicing longevity clinician, originally trained in internal medicine, and she also has an exciting new business she's working on called CareCore, which is designed to help make longevity medicine more accessible to more people by partnering with people who have influence. Um, and so, what we're going to, both of us have been in and around the longevity space for a while. In fact, I still remember the first time we met. I think it was at the first Longevity Docs Summit in New York, and we were both sitting next to each other. And I think we were both kind of just getting started with our respective journeys, and it's amazing to think how much the world has changed since then. But today we're going to be having a really good conversation, really about what we were thinking about back then, which is where is longevity medicine going, and in particular, is it a bubble? Like, is all of this stuff that we've been so excited about, so hyped about for the last couple of years, is this all going to collapse like a house of cards, or something like that? So anyway, like, Hillary, welcome, and please feel free to add to what I just said, and we can dive into some of the great conversation that I'm sure we're going to have.
Thank you so much, Anant, for that amazing intro. And I just want to say, I also remember that day when we first met, and it was a completely different time because I recall being from a traditional background, although, as I'm happy to explain, I had a wild journey through a very different part of medicine. I worked in psychedelic medicine for some time too. So I was experienced with what it was like being outside of medicine, but longevity medicine itself as a phrase was still picking up steam and credibility, I think. And turn around to now, I think it's been a couple of years and it's much more legitimatized. A lot of people regard it as an actual field. It's not like a board certified field, but it's an actual field that people care about. So I think you and I have discussed several times, like, what does longevity medicine even mean? And that is at the crux of the question of whether it's a bubble, I think. So I'd
Mhm.
love to even start there. Maybe you have some thoughts that you want to start with about how do we even define what is longevity medicine?
Yeah, no, I mean, it's amazing that we're still having to ask that question now, 2 or 3 years into all of this. But I think that I still think it is an open question. And I think it speaks to how much further we have to go to make this into a more, formal type of medicine that the rest of the field can engage with, right? Because I still think there is not a clean definition. Um, I think there's a bunch of related terms that I think generally float around longevity medicine that kind of generally describe some of the similar approaches that you and I and other doctors in our network take, and those include terms like functional medicine, regenerative medicine, personalized medicine, precision medicine, preventative medicine, lifestyle medicine. These are all terms that are out there that I think loosely, I think, are orbit this term of longevity. I think the term longevity has kind of gained traction for a variety of reasons. I think one of which just has to do with the fact that it has like this really kind of aspirational bent to it about how we can live longer and extend our lives, and it feels almost like kind of sci-fi, but not so out there that it doesn't feel approachable and grounded. So I think that's the term that we're living with. But I think, to me, just to kind of answer your question, I think to me, longevity medicine describes an approach to medicine that is highly personalized, deeply personal in a sense of how it is adjusted to people's goals and individual needs. And it importantly makes use of data, precision data, to help guide the approach. But that's just kind of how I think about it when I'm asked. But I'm curious, like, how do you think about it? When you're asked the question, like, what is longevity medicine? How do you answer?
Yeah. I have kind of this more off the cuff answer, which is longevity medicine is all the healthcare that you actually want. a traditional or conventional medicine, or as I often say, insurance gated or sick care medicine is the healthcare that you often only go to if you absolutely need to. And so, and the reason I say that is because you're right. Like, I think people have co-opted the term longevity medicine in so many different ways that that broad bucket is the only way I've figured out to, group it all together. And I think it's true. Like, you wouldn't encompass, for example, a trauma surgery that you had to get because of X, Y, and Z, car accident as longevity medicine. And you probably wouldn't classify a cancer care right now as longevity medicine, although I'm sure we could get down a rabbit hole about, I'm actually really excited about that. My background's in oncology, and I think there's a lot of information we're learning from the science world between what we're doing in longevity medicine and chronic disease, inclusive of oncology. So that is to say, I have a pretty broad scope as to what longevity medicine is. And I think my answer to whether it's a bubble is I think not, because I think there's not only consumer support for it. Obviously, everyone wants this. It's in the very definition, I believe, of the entire wave or movement. But I also think that a lot of clinicians like you and I, this is what we wanted to do when we got started. And I think many of us, due to indoctrination, basically through medical school and training, we learned what it was to practice within the system. And I could go into all the personality types, but you may have heard like certain personality types go into professions like law and medicine. And typically it's a more conservative, conscientious type that follows certain rules. And as a result, clinicians as a whole don't tend to break free from the tradition or the mainstream version of their field. But that being said, I think within all of us, there's this little voice that tells us, oh, this is the way to practice medicine when I first dreamed of becoming a doctor. And more people are seeing it as a viable career path. So,
yeah. So let me just kind of answer the question too, which is kind of the question that headlines this conversation. But, I agree with you that this is not a bubble, in the sense that I don't think the concept of taking this more personalized approach to care, this more empowering approach to care, physicians, just to kind of echo everything you just said, which I completely agree with. I don't think that that's going to go away. However, I do think when we look at it strictly from a commercial lens, from a business lens, right? I do think there are certain aspects to what is happening right now. And I think maybe this can be a segue into kind of the more commercial and business discussion, which I'm sure our audience is excited to hear about. There are certain aspects to what I see happening that do feel potentially bubbly, if I can use that term, right? And I think the first thing I'll just point out is just like the tremendous amount of investment capital, especially from risk capital, venture capital, that's flown into the space. And I don't have an exact figure, but I think you and I can both appreciate that it's a lot. Like, you just look at the latest funding rounds for companies like Function and Neko and some of these other companies that are, real headliners for the space. And there's a lot of money flowing in. And as you and I both know, all of that money has to eventually deliver. There's an expectation attached to that. There are revenue figures, growth figures that are expected out of that. And I do wonder, despite all the realities of how much consumer demand there is and so on and so forth, can these companies grow into these very lofty expectations, right? I believe Function is valued well over $4 or $5 billion. Just looking at public market healthcare companies, like that implies like at least a $100 to $300 million revenue run rate. I don't know exactly what their revenue is. I don't know what their profit margin is, but can these companies grow into these big boots that we're now fitting them for? I think is one of the big questions. The second thing, and then I definitely want to have you come in, is, and you and I have spoken about this, is how much of the growth here seems to be tied to GLP-1s, and in particular compounded GLP-1s, right? Like, there's been an explosion of growth in telemedicine, but especially in the part of telemedicine that relates to longevity, preventative medicine, driven by GLP-1s and compounded GLP-1s. And I do wonder, as GLP-1s become more and more affordable, with Trump RX, and I know Trump RX is still kind of a plan, but if they do execute on that, and if branded medication becomes more accessible, what does that do to all of this? So anyway, like those are just two things I think about, right? Like, can we, in a world where direct to consumer acquisition is harder and harder, like acquiring customers on Facebook and Meta and platforms like that becomes harder and harder, can these companies grow into those revenue figures? And secondly, like, is there this, big dependence on GLP-1s and compounded GLP-1s that will, kind of be a failure point if that goes away? So I'm curious, what do you think?
I love this. And I will say upfront that I feel for investors trying to make bets. It's like making a prediction market bet. It's you're evaluating factors that by nature you cannot predict accurately. And so a lot of times, and people criticize investors for this, but I understand why it happens. People just pile on to a certain bet. And without naming any particular companies, I've seen that happen over and over again, where some big player places a big bet and then everyone else piles on. And whether that's a smart thing to do because, the more bets there are for one player, the greater their chance of success, or maybe that's a bad idea because then you end up with overvaluation of a company. That's what remains to be seen. So I think, first of all, there's the trouble with following investment news as any sort of signal is problem number one. I think what you brought up about the GLP-1s, actually, I've seen so many companies with little to no investment generate hundreds of millions of dollars a year due to just operating in that very space. You mentioned the GLP-1 compounded space. And so why would you take on investments of, even $100 million when you can generate that amount of money and have full ownership over a company? So it's really interesting because some of these most profitable companies are not, it's not sensible for them to take on investment. And then you're going to hear the argument that, oh, well, those type of companies, they are operating in this way that they have limited growth. VC betting is more for this SaaS-like growth where there's like infinity and beyond, such as with, the big tech companies of our era, like a couple of decades ago, what that growth looked like. And I don't know what the future holds, but I do suspect that in a lot of ways, we're trying to copy or chase success that's long in the past, or maybe doesn't quite fit for certain healthcare types of businesses. So that aside, going to the question of, where the value of companies will eventually go, I very much believe in the pharmaceutical revolution right now, and startup founders are incredibly creative. So my instinct is there will be some delta, there will be some alpha, and some way for founders to figure out how to, derive value or generate value for their customers than their own companies. It's not 100% clear to me if, that direct sale of compounded medications for a margin goes away, what that will mean. But I just feel like there's so much overall value going into the space of medication specifically that it's hard to believe that, all of these healthcare companies will go away. I think we just have to find a new model and that will come. So.
Yeah, no, I agree. And I think just to kind of reiterate a couple of things, right, that you mentioned, right? Number one is just, it is astounding how many companies have made insane amounts of money on compounded GLP-1s alone. Some of these are companies you've never even heard of.
Yeah.
They're just, if I had mentioned the names, which I'm not going to, but like you mentioned some of these names and the people listening to this would probably never even heard of them. And they're making like hundreds of millions of dollars per year, right? Which is insane.
You could just go to, I think Forbes has a list of best telemedicine places to get. Yeah. I was like, every single one of those on that list of 30 or something are probably making around
Yeah,
that order of
exactly.
yeah.
Exactly. And then the other thing is just, when you and I we were at A4M back in December, which is, for those who don't know, probably the biggest trade show conference for this field. And the people who have the biggest booths, it's kind of telling. Any conference you go to, the people who have the biggest booths are the ones who are making the most money and who are kind of helping to hold up the industry, or one of the pillars of the industry for everyone else. And if you go there, the people with the biggest booths were all University of the Compounding Pharmacies. And that to me was, again, just telling of like how dollars are flowing in this ecosystem. I mean, there were none of these telemedicine companies were there, because this is not really a conference for them, because they're just, they're acquiring patients. But the amount of revenue and economic value that's been created from GLP-1s, I think most people do not understand, like, just how much it is. I think that one thing I will say also, I think at least right now, it is very hard to overestimate how big the market for GLP-1s is. I think people, they feel like, oh, the market's tapped out, like everyone's already on GLP-1. There's still, I mean, the number of people who could benefit from GLP-1s is so vast. Like, this is like a market size that the numbers are just not numbers that we're used to thinking about, or like people who are investors are used to thinking about, where like so many people are going to be a part of the addressable market, right? Like, the last time I can think of something resembling this would be like maybe social media or mobile phone, just like something, and those are like, universal, but like we're talking something that is approaching that. So like the market size is just massive, right? So I agree with you though, that like, I think that things will play out as they will on the regulatory side. None of us have a crystal ball. And then I do agree with you. There is enough, I think, organic interest and from patients, and enough kind of intelligence and creativity from entrepreneurs to find a way forward. And like, I do think that biomarkers are going to play a big part of it. I do think that, data is going to play a big part of it. And honestly, just care, right? Like giving people support and accountability. And this kind of relates to ChatGPT Health, which I know that you and I talked about before the show. Somebody's already mentioned it in the questions, but anyway, I think that all that's relevant to that. But maybe let's talk about ChatGPT Health now, since it's come up, and I know it's going to be of interest. So what do you think? I know that you've written about it, but like, I would love to hear from you in your own words, live here. Like, what do you think about ChatGPT Health? What do you think it means for the ecosystem? What do you think it means for other businesses that are building in the space?
Well, first of all, I think it is promising, is my one sentence summary. It is promising, and it is a great step in the right direction. Right now, it is such a beta release, and I think so many things have broken down when I've tried it that it's only halfway useful. So let me give a clear example of something I got so excited about, but then it started failing. So I connected it to all the things I could figure out. Like, I used the HealthX connection to connect it to health institutions. I used the Function Health to connect to that. And then I used it to connect to Apple Health. Of all of those, I'm happy to quickly review the stuff from the EHRs. I will just say, not super helpful, because I think what people don't realize who are listening is that what gets put into EHRs is often very little useful data. It's like all this documentation data and stuff that you probably already have. And you probably could have just easily copy and pasted the stuff that you could get for yourself already. So I found that to be not terribly useful. I think somebody with way more labs at a certain institution would have found it extremely useful. Like someone who's hospitalized or maybe going back over and over again, that would have been really useful. The side with the Function Health, I found it interesting, but ultimately I realized why that it was limited. So it's limited because it's limited to Function Health's interpretation, which is basically normal versus abnormal and recommended diets and all the other things that, Function Health recommends.
They don't pass the raw data. They pass their, yeah, that makes sense. I was going to say, like, otherwise it doesn't make, I was kind of surprised. Why would Function Health participate? But I think knowing this structure, that makes sense. But yeah, please continue.
No, yeah. And I think that might be useful for some folks out there. For me personally, I found that super limiting because I was like, I don't know, like you and I are probably more towards the as clinicians, biohacker end, in that we want the raw data and we want to interpret it directly. So I found that not very useful, but someone might find that quite useful. And then the Apple Health was the most promising because I have an Apple Watch. I've been wearing it for years, and I was like, oh, there's so much exciting stuff. So the key questions I started asking that were really interesting to me had to do actually with patterns related to like my menstrual cycle. And I was like, okay, like tell me about like sleep and quality and, you know, measurements like my heart rate, respiratory rate, HRV. And immediately it, you know, was running all of these correlation analyses. And it did tell me a couple of interesting things, which were validating more than, you know, super surprising. Like, oh, during the luteal phase, your resting heart rate goes up by a significant amount. Like statistically, it's significant. And so does your respiratory rate, but your HRV doesn't. And I'm like, okay, that's like really cool. But then I realized that it was half broken because it was only pulling 3 past cycles. And I know I have like so many recorded, and I kept arguing with it. I was like, you have more data. And then they're like, we see 20 cycles, but they're all from the last 3 months. And I'm like, that's ridiculous. So there's something breaking down with the integration itself that is making it less than totally useful, but it's in the right direction because, like we were talking about earlier, longevity medicine is all about personalized insights. And at the end of the day, if a consumer can get to understand their body really, really well using wearables, using a connected AI, like at this depth of detail, we could have amazing insights and we can act on that in a way we never could before.
Yeah, no, I agree. And that's interesting. Thank you for sharing kind of your hands-on experience. I actually have not had a chance to use it yet.
Yeah.
But that is super interesting. I think with respect to the health information exchange, like the hospital data, I think that is very much a good example of like garbage in, garbage out, where there is a lot of data there, but very often it's not structured in such a way to make it useful to somebody who's using ChatGPT Health to get a deeper sense of their health understanding. I think what you said about the wearables, I think is super interesting. I also see a lot of potential there. I think like the big unlock with ChatGPT Health, and I think I remember you writing about this in your post, is it's really the integrations, right? Like how seamless those can be. It seems like they're not working perfectly well, but you know, in theory, what ChatGPT Health is doing now was possible, you know, like even like a year ago. Like if you created a project and if you just exported your data and you uploaded it to that project, you could basically recreate what ChatGPT Health is doing now. The problem was for most people, you know, it's painful to kind of export all the data and upload it, and you have to keep, you know, maintaining it and keeping it up to date. So if this can seamlessly do that, again, there's not a lot of sophisticated tech around that, but it makes it seamless, right? So I think these data partnerships and integrations are going to be really, really important. And so if that can be made to work really well, then I think it could be you know, huge. It could be really, really interesting.
Totally.
With all that being said, like I do think, and I think before I kind of give you my opinion on this question, I want to give it to you, which is, so what do you think this means? I mean, obviously it seems like the product's new. There's still some rough edges. You know, I'm sure they can work those out. What do you think this means for direct-to-consumer healthcare longevity companies like Function Health, for example? Like, what do you think this means for companies like that are trying to provide insight and personalization around biomarkers, or even, and let's just kind of make this really relevant to our audience, like there are people out there, there are doctors out there who are saying that, oh, they're trying to, you know, deplatform doctors, they're kind of displaced doctors. And so, you know, what do you think about what this means for, let's just put it in 2 buckets, for the direct-to-consumer healthcare companies, and then also for doctors more generally who want to deliver this type of medicine?
I love this question. So I think I wanted to start off with health is a gigantic category, and the market is large enough for everyone to find a way towards success is my TLDR. And starting first with the clinicians, because I know we have so many friends and colleagues who think about this all the time, is there will always be enough patients for you to see who prefer seeing you in your whatever style it is. And I would argue every single clinician has a particular style. It's a very personal relationship that you have, like having a therapist, essentially. And we see that because even you and I, I'm sure, like we think the same way, but I'll bet we have slightly different opinions about what to do in X, Y, and Z situation and what, products are ready for use, et cetera. Like there's subtle details. And so for clinicians, there's always going to be enough to fill your panel, whatever way you like. I think the important piece is to, find that opinion, like what is it that you believe in, develop an opinion about things that are coming out, and go a little bit more either local if you're an in-person business, or develop some sort of brand around like your digital if you are going broad. So that's on the clinician piece. And for the startup piece, so this is a little bit trickier because startups, we're talking about like venture scale type startups here. By nature of that definition, you're trying to encompass a giant field. You're trying to be the next big thing. And there's going to be fewer opportunities, I believe, here. And the reason is kind of like what we were talking about already, which is that a lot of these big opportunities, they're best grasped by the biggest companies. Like we're talking about Apple Health right now. And then there's going to be Android Health, which I know is going to connect with the Anthropic version of the health suite. The largest companies are partnering on the back end for the more B2B sort of companies. So there's less to get in right from the start here. But I do think that there's some general things to not do, perhaps. One is, you're not going to win on a chatbot-like product. I know there's a lot of founders maybe considering this or building something where they're like, okay, we've like fine-tuned our chatbot for X, Y, and Z. I am a big believer and I'm heavily influenced. My partner is an AI scientist. So like I don't admit to know everything, but I absorb some of the information that I hear from him. And a general foundation LLM model is going to exceed the skills of any sort of niche, type LLM for the chatbot purposes. There's going to be exceptions for like really specific tasks. You might be able to use LLMs in a particular way, but I think you'll have to get creative if that's your main go-to model. And I've talked to endless founders who ask me opinions about their version of a personal health record, so a PHR. And I think we're seeing that that's not going to work. You're not going to be able to compete with the open AIs, the Anthropics. I have no doubt that, by the way, Google is also thinking about it. And when we started this whole conversation, I actually was thinking about how much lately I've been using Gemini, even though Gemini is not actually connected to any of my health data explicitly. I've been building so many workarounds with it that it essentially kind of is for me. And it's just been working well, but that's because the model itself has been so good lately, this past month. So the landscape is constantly changing, but I think definitely I wouldn't play in that sandbox. I would think about an alternate sandbox, whether it's a novel, more interesting, more accurate way of data collection, such as a wearable that is new in some way, or cleaning data or ensuring that data integrations are really secure. Security, by the way, speaking of, is the number one priority here. So for OpenAI, for example, we were talking about the ChatGPT Health. I was like sort of okay with the fact that it was breaking down all over the place. But what I would not be okay with is if security wasn't extremely tight, like if it was leaking that data in any way. So I think that is still the foremost concern. So there's a lot of places to play in, but I wouldn't do it in the most obvious place, which for most companies has to do with like some kind of PHR or some kind of chatbot.
Yeah, no, I think I agree with that. And I would say my thoughts for both clinicians and for the companies. And I will admit, like, I'm obviously somewhat, biased here because I'm, the chief longevity officer at Superpower, advisor to the company, is that there's two parts to the equation here. One is providing information and insight. The second part is actually providing care and actually changing behavior and changing biomarkers. And I think in general, if what you're doing is only the information and insight part, then I would agree with you that like your ground is shakier, because there are now these companies that have way more distribution, like ChatGPT and Claude and Gemini and others, that will be able to do the same thing equally, if not even better than you can soon. But what they can't do, at least yet, obviously there's like the singularity possibility and all this stuff. So we have to leave that aside, right? But at least there's no direct line of sight right now to them actually participating in that care loop, where you actually have to build a relationship with someone and build accountability with them and personalize to their unique situation, right? AI can be used as a tool there. It can be used to augment, but it can't replace, at least right now, right? So I think if you are playing in that second part too, which I think most doctors kind of by definition, or clinicians by definition are, I think that, at least right now, I don't think this is a concern. I think if anything, this could generate more awareness and more kind of business for you, because as people get more information and insight, they're going to be more motivated to take action. And that's where they're going to be seeking out clinicians like those of you who might be listening. I do think there is another variant to all of this, which is if you're building tools that are more targeted towards clinics versus to consumers, right? I think to consumers, the distribution challenge is very hard to overcome, because it's very, very hard to acquire general customers, because there's very, very small, there's a very narrow set of places to acquire, patients or general population. But if you're talking about building tools or software or solutions for specific niches or specific parts of the industry, I do think there is a way to carve out a niche there, because what that requires is deep personalization, customization, understanding that customer persona really well. And again, like that's something that these foundational model companies probably, at least right now, are not going to have the interest in doing. And in fact, Claude and Anthropic seems to be very deliberate about their positioning as, hey, we do not want to rise to the product layer. We are here to empower companies to do what they want. I think OpenAI, and I don't really know where Gemini and Google stand, but OpenAI definitely is trying to play in the product side. And that's why, I'm sure you've heard, like some people have, with startups, right? Like startups are having trust issues, so to speak, with OpenAI. But in any case, I think that there's still a lot of opportunity. I think you just have to be thoughtful about, how much of the care cycle, the care loop, are you actually participating in?
Yeah. Yeah. Yeah, and you're reminding me too, like big companies, they have a lot of information, a lot of intelligent strategists, and they're thinking way far in advance in certain companies. I'm not gonna say all companies. Some companies live in the past, as far as I can tell. But I was just thinking about the NVIDIA Eli Lilly partnership for the closed loop AI drug discovery lab, wet lab, like a physical lab. And I was like, that is game changing, because how many AI drug discovery platform startups have come out in the last decade and a half? And we have zero AI drug discovery commercializations in that amount of time. And now I think this is going to make the real difference. And so there's certain places, and it's easy to look at that and be like, wow, those are two juggernauts. Like, how do you compete in that space? But I think there are small versions of that insight that a smaller company could have done. And I think, founding startups, and why I love it. Even I had this whole journey where, I founded my first startup, and then afterwards I was like, there were so many problems with the VC backed world for healthcare. And I wondered if I ever go back, but it's such a creative, invigorating space that you just like want to keep going back. You want to keep innovating. I think it's an itch that is never satisfied. And I think, entrepreneurs throughout the ages have figured out how to continue innovating. So,
yeah. Well, look, I think we're past the 30-minute mark, so I really appreciate the conversation here. This was a lot of fun. If you're okay, Hillary, maybe we can just field a few of the questions that have
sure.
popped up here, and then we can wrap up. Does that sound
Sure.
good? Awesome. And so I am going to kind of filter a little bit. So one is about OpenAI and ChatGPT Health. I feel like we've talked about that. And okay, so I'm just going to pick out like one or two of the best ones here. So, okay, so one person is just kind of responding to our comments about Apple and all of that. So they say that they think that Apple and Garmin have been correlating data and providing health insights for a while, which is true, right? I think Apple is most likely to be the strongest of all. They've done the best job historically with data ingestion. Don't have an LLM, but will be interesting to see what they do. So I guess not really a question there, but I think that what I would say, and I'd be curious to hear what you think, is, I think in some ways, like what we're seeing with ChatGPT Health was always kind of there in maybe a much more basic way with Apple Health Kit. It did give you some insights. I think the missing ingredient now is, number one, like a more powerful model, right? Because Apple Health Kit was not really using a LLM. The second thing is the cross-indexing and integration of other data points. So I guess my question to you, Hillary, just kind of building on this one, would be like, by the end of this year, like how sophisticated do you think these kind of personal health insight, personal health records will be? Like, what do you think they'll be capable of by the end of the year?
Oh, I think they will probably already be working as perfectly as we could want. And actually, the limitation is going to come from the measurement side. And so I agree with the question asker that Apple Health, I've always thought that Apple Health was the biggest winner long term. And it's not an AI play. It's a measurement play from the watch, et cetera. And it's a data collection play. So it's absolutely winning there. Apple themselves has always had a very strict policy around not, divulging a lot of data, using the personal data in a lot of ways. And I think that's very trust building. So I kind of agree with that. But as a result, the insights you get are very limited. So on the other hand, OpenAI and similar AI companies are not afraid to just go in and then, give interpretations however the AI outputs. And so the pairing actually makes a lot of sense, but they're just very different strategies / products and companies because one is on the data collection and storage and one is on the AI interpretation. So I think the interpretation is basically about as solved as we can be in terms of the intelligence. It's that integration layer. And then by the end of the year, we're going to find ourselves frustrated that we couldn't collect actually more interesting data. So like we couldn't collect exactly what, my hormone levels were at a specific moment in time. And because, the continuous hormone meter hadn't yet come out or something like that. We couldn't measure exactly like when we ate this type of food or that. Those are the questions that are going to be bugging us by the end of the year.
Yeah. Well, that's very well said. And I'll just say what I hope happens, and this hasn't happened yet. It's been like a big promise for a long time, but it hasn't happened yet. But I hope this is the year. But I am still waiting for the time in which our access to these types of data signals can actually move our understanding of our own bodies, like the science itself, forward, right? Like right now, what Apple Health Kit and ChatGPT Health is doing is basically applying what is already known about science, what is already known about biomarkers and how they interact, and applying that and providing insights. What I'm looking forward to, and people are talking about this, at the far end of R&D and using some of the really sophisticated models like 5.2 Pro and stuff like that. But I actually want to see how we can use this data in a way that's, of course, somehow consistent with privacy and security and all those sorts of things. But how can we use all this amazing data that we're collecting to actually move our understanding of biology forward?
Yeah.
Can we generate hypotheses that we can then study more closely, or can we gain new insights into how different parts of our biology interact? Like, that's what I'm hoping for, because then we can really start to see how all this can accelerate, right? As more people start using these wearables, integrating it with powerful models like this, if we have a way to translate that into a better understanding of biology, I think that becomes very exciting for everyone. So
yeah,
let's see where we wind up.
Yeah. And this is my last little thought there is I'm with you. And I don't think it's a this year solvable problem, but looking into the future, I'm so excited about how can we incorporate massive data sets like our genomics, epigenetics, proteomics, lipidomics, metabolomics, and understand that on a day-to-day. That's going to really unlock true N of one and allow us to do personal experimentation, understand our own body's responses to different things. Because I'm sure you've thought about this. We're both Asian by descent, and a lot of data out there, first of all, doesn't focus on that we're reading in scientific journals. And even on the individual level, like, we have very different characteristics that result in different reactions when we try different interventions. So I'm looking forward to that day, but I think it's not a 2026 solution.
Yeah. Well, let's see. I would tend to agree with you that it's going to be hard, but I think the last few years have proven that things that seem impossible may actually not be, maybe within striking distance. So with that, thank you so much, Hilary, for speaking with me. I hope we can do this again soon. I thought this was a lot of fun.
This is so much fun, Anat. Thank you.
And hopefully our audience agrees. And so let's maybe work on trying to do this again sometime soon. And for everyone else, thank you so much for listening. And I hope you guys all have a great start to your year, and we'll see you out there.
All right. Take care, everyone.